this is the thyroid cartilage, this is the cricoid cartilage, right? Right? And posteriorly you can see lamina of the cricoid here, arytenoid here, carniculate here, and epiglottic cartilage here. Now I am showing you by putting this model here. Okay. So, what are you looking? The A is placed on hyoid bone, correct? B is placed on thyroid cartilage. You can see the superior cornu or superior horn. You can see the superior border and the notch of the superior notch of the thyroid cartilage. Again, superior border. This is all superior border with its notch. This is the inferior border, and this is the cricoid cartilage. The cricothyroid ligament is here. This is inferior horn of the thyroid cartilage, which is making a joint with the cricoid cartilage, cricothyroid joint here. Okay, and you can see the epiglottic cartilage is attached here internally on the angle of the thyroid cartilage. Clear? Now, if I turn the model this way, now you are looking at the side view. Okay. So body of the hyoid bone, superior horn of the hyoid bone. This is the posterior cornu of the hyoid bone. Okay. Superior border of the thyroid cartilage, inferior border of the thyroid cartilage. This is Adam's apple here. Okay. And superior horn of the thyroid cartilage. This is the inferior horn, and this joint is between cricoid and thyroid. So this joint is known as cricothyroid joint. Correct?
Yes.
Okay. Now, when you see the posterior view of this model, now what you can see now? You can see the posterior surface of the body of the hyoid bone, superior horn of the hyoid bone, cornu of the hyoid bone. Then you can see the posterior surface of the thyroid cartilage, the superior border of the thyroid cartilage, its notch. In the center is the two laminae unite at the angle of the thyroid cartilage, and it has got a superior horn and inferior horn, and this is the posterior border of the thyroid cartilage. On the other side, posterior border, superior horn, inferior horn, and inferior horn is making joint with the side of the cricoid cartilage. So you are having cricothyroid joints on both the sides. Easy to understand?
Yes.
Okay. So I can place this thread like this. Now you can see the cricoid completely, lamina of the cricoid completely. No problem here? What is this? One arytenoid, another arytenoid. What is this process?
Muscular process.
Literally, this is the muscular process, correct? And vocal process should be located anteriorly. What is this small cartilage? Carniculate. Very good. This is the cricoid, and this is the first ring of the trachea. Thyroid cartilage is deficient or absent posteriorly. Similarly, the tracheal rings are C-shaped, and they are also absent posteriorly. Okay, you can see that here. So posteriorly, tracheal rings are C-shaped. They are present anteriorly. Posteriorly, they are absent, and there are muscles in the wall of the trachea. So this part of the trachea is very soft, and it's related with the esophagus. Okay, right. Now, if you see the model from top, okay, like this. what you are seeing now? You are seeing the attachment of the epiglottic cartilage here in the angle. And what are these two white things?
Vocal cord.
These are the true vocal folds. And what is this cartilage? Arytenoid cartilage. And what is this process known as?
Vocal.
Vocal process on which the vocal fold is attached. You agree with this? Okay. Now when the lateral or muscular process will contract, it will pull the muscular process laterally and it will open the rima glottidus. So I am doing that, you see. It will open the rima like this. And when it relaxes, it goes back. Okay? So this is the rima glottidus. When you pull the lateral process laterally, it will open the infraglottic part. Okay? Right. Okay. This was to understand the framework of the larynx, which is cartilaginous, and this is how you got it. Now we come to the muscles. Looking at the anterior side, you understand it now? Very well oriented. You can see the thyroid cartilage, Adam's apple, its lamina. You can see the cricoid cartilage. You are looking at the anterior side. This is the hide bone. There is this muscle which is arising from thyroid and it is going to. So what is the name of this muscle? Very good. Thyroid muscle. Very good. And there is a muscle label A here. It is coming from where? Cricoid, and it is inserted in the inferior border of the thyroid cartilage. So what is the name of this muscle? Cricothyroid. And it is, what is the action on the vocal fold?
Tension.
It is this joint on which this joint will form fulcrum for this muscle. So when this contracts, will it pull the whole thyroid cartilage anteriorly or posteriorly?
Anteriorly.
No, anteriorly.
If this was attached posteriorly on the lamina, then it will pull posteriorly. But this is attached anteriorly. Yeah, it will pull anteriorly. How? You see, this is a joint over here. When the muscle contracts on both sides, it will naturally pull the thyroid. Since the joint is here, so naturally the thyroid will move anteriorly. So what will be the effect on the vocal fold? It will be tensed or relaxed?
Tense.
Tensed. So it is a tensor of the vocal. Not close. Cord will remain in its place. Its length will increase. Just like you have a plastic or rubber, you tense, it will become bigger. When you release, it will become shorter.
When it's become bigger.
When it tenses, it will raise the pitch of sound. The sound will become shrill or very loud, like a child is crying. When you cry, you tense and you increase your pitch. Okay? Right. Okay. No problem here? Okay, when you see at the back, are you oriented? Very well. Where is the thyroid now? All of this is thyroid, correct?
Yes.
Superior horn, inferior horn. Where is the lamina of the cricoid?
There.
All of this,
Yeah,
correct?
yes.
Okay.
Yes,
Where is the arytenoid?
Above.
This one?
Yes.
Where is the muscular process? This one?
Yes. Lateral.
Yes.
This is the muscular process, lateral. Vocal will be anteriorly. Okay. Now there is a muscle here from lamina posteriorly going to vocal process. So what is the name? Posterior cricoarytenoid. Very good. Okay. Then there is a muscle here which goes transverse. This is transverse arytenoid. And there is a muscle here except this is. These are two oblique arytenoids. And if some fibers of the oblique arytenoid go to side of the epiglottis in the aryepiglottic fold, what will be the name of the muscle? Aryepiglottic muscle, which is not shown in this diagram. Again, if I show you this model like this, now you are looking at the internal aspect of the larynx, where the epiglottis is attached internally, and what are these two? True vocal folds. This is the vocal process here. Can everybody see this? You can't see?
Yes.
Oh, okay. Let me try to do something for you. I hope it should not fall. Okay. Now you can see, this is the posterior surface of the thyroid cartilage. This in the center is the angle of the thyroid cartilage where the two vocal cords are attached. They are coming from a process here from this arytenoid. So this is your vocal process and this is the whole vocal cord. Okay? And this muscle which you see in the vocal cord, this is known as vocalis. Vocalis is used when you whisper. When you whisper, it relaxes the posterior part of the vocal cord. Whispering means silent talking. Keep quiet, keep quiet. This is the action of the vocalis. Okay? And when you pull the muscular process, you can see the rima glottidis must open. Okay? Can you see it's opening now? This is pulling on one side, but on the other side it's weaker. So both the rima should open. So this is how you can see the rima glottidis opens there. Now on the inside there is one more muscle shown, but how I can show you that to you. Can you see a muscle here? A muscle here, this one. Oh, this muscle. Okay, this is your anterior, this is your lateral thyroarytenoid. So all the muscles are present in this model. I will keep it on your table so that you can have a look for extension of the larynx, extent of the larynx, these two models. So you can give this at the back.